we do have our Slido QR code up here, so we can take attendance that way if you're able to. And if you don't have a phone to do that, you can just go to slido.com and enter the event code 4411510. If you get a chance, thanks. And let's see. I think we can go on to the next, I think. Also with this, of course, we want to welcome everyone here. We are always so excited to see your faces and just love how you all make time out of your busy schedules to join us. And I know I had the Slido pull up there for attendance. We would like, if anyone's new to the council today, if you'd like to just unmute, we'd love to meet you and hear a little bit more about you. If you don't feel like it, that's fine. But if there is anyone new here, please go ahead and let us know. We'd love to meet you.
Hi, my name is Elise Stewart. I'm with Decatur Parole with the IDOC, but I oversee McLean County as well. And I'm a re-entry CAS. So I do risk assessments and help connect parolees with resources that are available.
Oh, awesome. Thanks for being here. You said you do work in McLean County as well?
I do, yeah, that is technically my area. And I have McLean County, Macon, DeWitt, and Piatt.
Oh, okay, great. Well, thank you so much for being here, Elise. Thank you.
Mhm.
Any other new people that have joined in and would like to share their information?
Hi, I'm a Rotary exchange student from France, and I'm interested in psychology.
Awesome, thank you. And I, excuse me, I did not catch I'm sorry, your name again, and what was that?
Alexis.
Alex? Okay.
Yeah, that's it.
Yes, okay. And thank you so much for being here, and you're wanting to learn more about the field and everything, it sounds like.
Thank you.
Well, thank you for being here. It's very nice to meet you. All right, anyone else?
Yeah,
Blake,
hey.
can you hear me? You can go ahead.
Oh, are you sure? Okay, yeah. I'm Crystal. I actually work for Task in the Bloomington area and Springfield area. So I work with male offenders getting out of Southwestern IDOC prison and also Sheridan Correctional Center. So we work with getting them into treatment, kind of working their way through the community, any resources that we can provide to them once they get out. So yeah, I've been with them for about 3 years now.
Oh, that's great. Thank you. That's awesome. Thank you for being here.
Thank you.
Okay. And I would also say if anyone who wasn't able to join that QR code, add their information, and especially for new people that are just joining, if you wouldn't mind, if you'd like to put your contact information in the chat, we can get that way. If you do want to share your information, contact, email, anything like that, but that's completely up to you. So thank you. All right. And was there someone else? I can't remember.
Yeah, that'd be me. My name is Blake. I'm a recovery specialist with DuPage Rosk and Serenity House.
All right. Thank you. And did you say your first name? I'm sorry, I'm having a hard time hearing my
First name's Blake.
Blake. Okay. Well, thanks again for being here. Oh, right. Okay, so was that everyone, I think, maybe?
My name is Zach. Sorry, I was having some issues with my Bluetooth.
Yeah, no problem.
I'm just here. I'm a person with lived experience. I've had a friend who used to work at Chestnut who is affiliated with Ross, who kind of, told me a little bit about the program. I reached out last month. I've kind of been busy with work, so I missed last meeting. I just emailed Kari back, I believe. So hoping to get involved with meeting up with her this week. I work with PATH. I'm not here officially with PATH, but we
Okay.
do crisis and homeless services, mental health crisis. And
Mm-hmm.
so kind of just recovery and mental health is intertwined in every
Okay.
facet of my life.
Yes, of course. I want to thank you for being here and sharing that. Thank you so much. I'm a person in long-term recovery and just love to have everybody here, that wants to learn more and wants to help and wants to share, because I think the more we do talk about it, the easier it is, and that stigma goes away and more education. So thank you so much, Zach, for being here. Okay. Anyone else? Is that?
Yeah, my name is Daryl Pass, and
Oh.
I'm the Senior Manager of Recovery Support Services here at Kenneth Young Center.
Yeah.
Happy to be here.
Thank you, Daryl, for joining. It's
Absolutely.
awesome.
My personal long-term recovery myself. Matter of fact, today is 12 years.
Congrats. And happy sobriety birthday. So
Absolutely. Thank you so much.
that's awesome. Okay.
I will go. Hi, my name is Natasha Nunu Ponder, and I actually did my graduate internship at Kenneth Young, so I'm very familiar there. I currently work at the Center for Human Services in the recovery program, and I'm glad to be here.
Thanks, Natasha. It was so good to see you. Thank you. And that's wild that you were at Kenneth Young. That's really cool. So, okay. And
I'm Dorothy Davis. I'm a regional coordinator for Parents Care and Share program at Bright Point. And I have worked in substance abuse at Broman, at Chestnut. So I got lots of work experience.
yes, you do. Thanks, Dorothy, for being here. It's great to see you.
Hey, Barb.
Yes.
I would say, since we've got so many new people on here, why doesn't the team go around and introduce who we are?
Sure. And okay, did we get everyone new? At least to this meeting? Okay. I'll just start. I'm Barb Brumlevy, and I am a community health specialist at Chestnut Health Systems, and I'm working on the McLean County ROSC and also the Ford County ROSC. And like I said, I'm a person in long-term recovery and very happy to be here. Kat, do you want to go next?
Yeah, I am Kat Hayes. I'm the recovery specialist for the McLean County ROSC.
And I'll chime in here. Good afternoon, everyone. It is so wonderful to see so many familiar faces, but also new faces on this call today. My name is Carrie Knapp. I'm the Associate Director of Community Health with Chestnut. I'm the Program Supervisor for the McLean County ROSC, but also our Ford ROSC and Livingston ROSC too. So it's again a pleasure to be on this call with so many of you, and thank you for joining us today. Kat and Barb, I'll turn it back over to you.
Okay, thank you. Okay. All right. So I know when we sent out our agenda, we had some information that we were going to have a speaker from Prairie, I can't think of the name, Kat, help me.
Prairie Pride Coalition.
I'm sorry, Prairie Pride Coalition, yes. And we're just needing to pivot because something came up, like things do easily. So obviously, happy Pride Month. We just wanted to share that information. We do have a QR code here that will take you to all kinds of resources. It will actually take you to our McLean County ROSC resource. There is a resource tab. It will be under LGBTQIA+ resources. So that will show you what's going on for the month for Pride Month, as well as all types of other resources. So if you can take a picture of that, get that QR code, and it will take you to all kinds of great McLean County resources. Okay, so now we're just going to take a little pivot into the main meat of our meeting, and we're just going to be talking about kind of changing the direction in ROSC coalition work for our fiscal year 25 for 2025, and just so people understand, when we're working, our years go basically based on our grant work, and so we're finishing up fiscal year 2024, and we will start in July for our fiscal year 25. And so we're going to work on this next section, just on and how we want to go about that, what we really want to focus on, what you feel people's needs are out there. So we can just go on to the next slide. And we just saw,
You want me to take it away, Barb?
yeah, actually, Kat, you go ahead, because we went back and forth on this. Why don't Kat will go ahead and start. She's going to go over all this. She is the expert. She knows a lot about this. And so
Oh, I'm not the expert.
Well,
I
you-
just know.
you know a lot about it. So
Yeah.
here's Kat. So go for it.
All right. So we're going to come back to what is the definition of a community coalition. And with that, we're looking at that again because the state is kind of shifting what we're planning on doing for our next fiscal year. So we just wanted to take a moment to go ahead and review what a community coalition is. And for the best definitions I found, I went with the Community Toolbox and CADCA. The Community Toolbox defines a community coalition as a group of individuals and or organizations with a common interest who agree to work together toward a common goal. CADCA defines a community coalition as a formal voluntary arrangement for collaboration among groups or sectors of the community in which each group retains its identity, but all agree to work together toward the common goal of a safe, healthy, and drug-free community. And obviously, we're not aiming just for drug-free, we're aiming for other things, but this just gives us kind of just a touchstone definition of what we're looking at for what is a community coalition. And if we want to head to the next slide, please. So we had the pleasure of going to the statewide ROSC meeting back in May. And we learned a little bit more about what the state is having a shift to as a coalition. They're kind of wanting us to get back to our roots of coalition activities. So over these next couple of slides, we're going to share what the state specifically Super has presented as coalition activities we need to be focusing on. So these include fostering collaborations and maximizing combined strengths and resources of diverse stakeholders to achieve meaningful impact and positive change in communities. So with that, we're looking at wanting to have some more partnerships and trying to divide the load of responsibility and planning amongst more stakeholders than just the ROSC team. The ROSC Council should focus on the big picture, which is going to be systemic changes and systems development and implementation of those systems that we're wanting to set up to outlive the life of the ROSC Council. So trying to plan more with a sustainable mindset. We're also looking at providing trainings. That's part of the capacity building, which is providing that education for the community on topics such as harm reduction, recovery 101, and health and wellness trainings. Next slide. Continued looking at what is coalition outreach. We are not focusing on recruiting clients for services. Outreach should be focused on sector representation, recruitment, engagement, and retention. And then other things we're looking at is doing advocacy for policy changes, raising awareness. That's a big thing we're still working on in McLean County. Addressing broader societal and systemic issues or challenges. As I'd mentioned previously, community education, and as always, stigma reduction. So with all of this in mind, the idea is we're not there to try and meet the need for putting in the solution. We're there to identify the need and to champion the need for the work to the community, for the community to take on. So next slide, please. So taking a look and stepping back, Those were some of the coalition activities that were shared by the state that they kind of want us to pivot towards. They're wanting us to kind of steer away from more of the direct service activities. And examples of these that they shared with us include support group meetings, providing of transportation, one-on-one recovery support or coaching. And then, of course, as one of our mainstays, which we're going to be kind of shifting away from, is doing stuff like sober social events. Next slide, please. So we wanted to take this meeting today to be very intentional, to review, just what the state had shared with us and wants us to move towards. And now really to reflect on, these are the key need gaps areas that we identified in FY24. And we're gonna take the next 20 minutes for discussion to go ahead and go through a series of questions to kind of do, okay, let's go by process of elimination. Which of these areas are really important for us to focus on over the next fiscal year? And also what is within our wheelhouse and our capacity to deal with? And then also eliminating which of these things are direct service ideas. And we've got Carrie shared a file in the chat that's got the questions. It's got this slide which will help guide your discussion. And I'll go ahead and turn this over to Barb and she will introduce the questions.
Okay, thanks, Kat. Okay, so as Kat said, we want to go break out into breakout rooms for some discussion on all of this. The slide before had all the different areas of possibilities that we want to work on and see how we can support. Like she said, there is a like a PDF or in the chat where you can pull those items up. But we're just going to break out into some breakout room discussions, 15-20 minutes, I would say. And the questions are up here. And I believe those are going to be possibly, or those could maybe, I don't know if you can put those or if that's in that.
We'll put them in the chat as well.
Okay, so those will go in the chat. So really just focus on which community needs are still relevant, how many of these community needs are something the McLean County Ross can address, and how many are direct service activity focused. The last one, what is the role of the McLean County Ross Council to address these needs and designate, and then we also want someone in the breakout rooms to designate a note taker to take notes and then report back in the main room. I know we want to do everything, but we really need to narrow it down to things that we can do, and how we can focus on those and work with, other agencies and collaborate on this. And anyway, I don't know. Are there any questions before we break out? I think
I'll
mainly
just go ahead and say, just due to the sake of the content of those priorities, it's a little bit difficult to put all of that in the chat. So if folks wouldn't mind just accessing the PDF version of our PowerPoint today to go to that slide and review the priorities within your conversations, that would be beneficial. And then the questions will be put in the chat, but then again, they're also on that PDF. So if anyone's having a difficult time accessing the PDF that was provided in the chat, feel free to let us know and we can send that to you a different way. That was also emailed out this morning as well. So that could be another way to go ahead and access that. I'll go ahead and start the breakout rooms. We're going to do 4 different rooms just due to the size of our group today. Again, please feel welcome to assign one note taker and a person to report out at the end of your conversation. And we're looking forward to coming back in about 20 minutes to discuss what was covered in each of your rooms. Welcome back, friends. We'll give folks just another moment here to join us. Alrighty. I think a few more folks are just hopping back into the main session here. But for about 10 more minutes here, we would like to just have each group report back out on what your group discussed. Our team is taking notes today. We're also recording this meeting, but really this is going to be a starting point of a deeper discussion that we're hoping to have in July. So really, we are looking forward to hearing from you, hearing what you want us to focus on in this next fiscal year as we kind of take that transition to focus more on coalition specific work, right? And what is actually doable and sustainable for this work in McLean County and the work that we're doing as a group. So I'll go ahead and open it up to whichever group would like to start us off, and then we'll take it from there.
This is Andrea. We were in group 1, I think. We kind of had a couple, just a few items that we really heavily focused on as needs. My kind of top one was safe, affordable, supportive recovery housing. Just obviously anyone who's in this community can kind of realize as you go around, there's such a huge need for increased housing, affordability, having those supports to help people be successful is key. So that's kind of my passion and what I do. And I see a huge need for that. The other huge area that we talked about was rural community outreach and focus in those areas, because a lot of members in our group, I had Jeff and Cammie and Abby, just talking a lot about the rural communities being missed. You don't think about, the lack of services and the importance of them being so far from services sometimes. So trying to find a way or to highlight the need of them to have access to those services, whether it be transportation or bringing more services to those areas, things like that. So I'm going to kind of look at my notes here. Oh, also, Abby, who works with Omni Youth, she's like an importance of collaboration in groups to maybe we're both working with the same types of target populations to where we can kind of collaborate and spread word of mouth easier and work together. And the other one other thing was that we kind of noted the importance of implementation of training and utilizing. We all in this group here are like a wealth of information and resources, and we love learning from each other to maybe look at utilizing each other's expertise and look inside the group to maybe learn more from each other. So I think that summarizes what we chatted about. So thank you.
Thanks, Andrea. That sounds like really fruitful conversation. It sounds like maybe some new priority areas, but also some things to continue focusing on, right? I know our McLean ROSC has really tried to dive deeper into that rural outreach piece the last several months, but really just only scratching the surface of what could be done there, right? So how can we really take a look at within our capabilities of our ROSC Council, what can we continue to focus on in the coming months? Thanks for sharing. Okay, group number 2.
I'm not sure, was that us or?
Sure. Go ahead, Colin.
Either way. All right, let's do it. All right. So we had a very, very good conversation. It was very, very nice. Fun fact, I actually used to work under Daryl when I was at Kenneth Young many years ago. So great to see him again. Congratulations to him for the 12 years as well. We really talked about, really like, first off, the basic needs like being met. So consistent access to food, healthcare, shelter, everything along those lines. It needs to be improved. And in this economy and everything like that, it's increasingly harder to be able to make that happen. Ensuring SNAP benefits and then having that consistent access to food is really a major portion. Because as a lot of us already know, diet's really the basis of anything and everything that we're doing on a daily basis. And then access to recovery services as well. Like I think Andrea had said before, getting into those rural communities and being able to offer such services. And then Tim also brought up a really good point, is exploring other niche recovery groups or other options for recovery groups. Because being McLean County a little more rural, you're gonna be having a little more of a 12-step and AA or NA emphasis. And looking at other things like smart recovery and recovery dharma, other things that are going to give other people a different kind of option, a different flavor and a different approach to recovery, because obviously 12-step and the approaches of saying I completely surrender to this is not going to be working for everybody. Versus you got like smart recovery, which is much more of like a cognitive behavioral therapy or cognitive behavioral psychology approach to that, and kind of modeling after also certain things that was going on in Northwest suburbs as well. Being able to get out and be able to do certain community events and collaborate with different organizations around us in either in McLean County, maybe just outside of our county that kind of border multiple other counties, are going to be really beneficial. I mean, Daryl was talking about, they partner with how many churches and different things, and McLean County, while it's another very large population of people, you look at certain things like Bloomington, it's something that's a little bit easier to adapt to a certain area, and we can be able to adapt a certain model to the different areas of McLean County as well. So I think at the end of the day, that was really about it there.
Awesome.
Just making information known, and then he also mentioned access to naloxone and fentanyl strips and stuff like that. The vending machines been a very big hit around how many different organizations and whatnot.
Absolutely. Awesome. Thanks, Colin. I appreciate you stepping up and sharing all of that. Sounds like some really great conversation. All right, let's go ahead and move on to group number 3. Whoever wants to take that away.
Well, I believe Colin stole our answers. Our group, Zach was very helpful in leading off, talking about looking for more smart recovery groups. And so maybe something that Ross can assist with is training for leading those groups, perhaps. So that was one focus, just having more availability in the community of options. And then the other one was recovery resources for youth. We weren't able to identify, and I feel bad because I overlooked Omni at the time, but whether it be the prevention programs that are going into the schools right now to have a complement to them of being able to reach the students as far as options for recovery support groups wherever they may be, and if there is a deficit, helping to get those stood up with whatever community-based organizations can assist with that.
Yeah, awesome. Thank you, Selena. Again, some really great conversations there. I have several thoughts, but I'll kind of tie it all in one big bow after we hear from group number 4.
I'm not sure what group we were, but honestly, we had a few questions that we really, I felt like we needed to answer before we could answer any of your questions. So when you said that you could no longer do sober social events, but one of the gaps says do more sober events. So
sure. Yeah.
What was that? Tell me what that means.
Yeah. And I apologize for not providing more clarification. It's not to say that we can't provide those events, right?
Okay.
We're just kind of taking a step back to say, well, versus putting our time and effort into so many of these events, right? How could we be equipping the community to make this a little bit more sustainable, right?
Right.
And taking a look at some of those other needs where we can be a connector and a collaborator, right? To move those pieces of the puzzle forward, right? So it's shifting the focus a little bit, not necessarily completely eliminating that off the table.
Sure. And so for a lot of the gaps that we were seeing, we thought partnerships and collaboration, that was the direction that you could go. That would be very easy. And then one of the other gaps was mentioning finding people in the sector that are underrepresented, that you could reach out, again, collaborate with different groups that represent those people and see what you can do to support them. Because it sounds like you're supposed to be doing more supportive work rather than, and that's kind of, we were just wondering if supportive rather than actual doing it on your own, just to create that that network that'll make you more sustainable.
Yes.
And then Dorothy very much said she would like to see some kind of collaboration that maybe would be for the kids that are actually going through and writing any kind of recovery, that they could catch them and be supportive, that she'd love to partner on that. So
Wonderful. Awesome.
and anything else, Amy, Dorothy, Jonathan?
I think you got it, Michelle.
Okay.
Awesome.
And it makes sense, Carrie, with not just doing events and having, because that takes a lot of focus and attention, but also doing other things. That makes sense.
Right.
Yeah.
Right.
Completely. You know, I really think our team in the state too is just taking a look at, well, what is having the greatest impact, right? And we love to say that our events are creating positive community change, right? But when we really take a look at it, is that what's happening, right? And how can we take a look at where we want to be in 5-10 years from now? And if Ross steps away, right, we want these efforts to continue and wanting this community to be set up for success in that way, right? So.
And can I also just kudos to you, because if they're saying that part of the problem is getting print literature out more places, you guys have created an app and you have created a data kind of a collection of help for people in the area. And so I think that may be a gap in other places, but I don't necessarily think it's in McLean County, because you guys are doing a great job.
Well, thank you, Michelle. And thank you for everyone for taking some time to collectively put together your thoughts and report those out to our team. I heard a lot of great ideas, right? I heard housing and food and transportation and recovery support groups. And again, all of those are such big needs in our community, but how can we refine that even one step further and come together in July to really think through, okay, as we're creating a sustainable network of care, how can we as a coalition address those things in a way that's not necessarily providing that direct support, right? So what can we do as a group to address transportation without actually driving folks to treatment, right? What can we do to address recovery support group needs without actually implementing a recovery support group ourselves, right? So really, I want all of us to be brainstorming that in the next 30 days, right? And Joan, thank you so much for putting your comment in the chat. She just made mention that it'd be helpful for the Recovery Community Center and our ROSC to get together to determine some of the roles in some of these issues, right? So a really beautiful collaboration there. And I think that there could be opportunity for growth and continuing to focus on these. So I just want to plant that seed in all of your brains. Again, we will be doing a hybrid in-person / Zoom meeting in July, and we're going to be continuing this conversation. But really taking a look at, again, some of those priority areas that were discussed today. How can we take it one step further? What can we do? What are some tangible items that we can focus on for next fiscal year? Barb and Kat, just due to the sake of time, if you're okay with it, let's go ahead and email out our ROSC updates, and then we can transition to any agency updates that folks might have today. And if we have time, then we'll go ahead and pull up a few of our ROSC updates. But as always, like we have shared, we love hearing from one another and hearing of the great work that's happening in the community. So we'll go ahead and pause and open up the floor for anything that anyone would like to share, any upcoming events or areas for collaboration, or just any thoughts or questions that maybe you have today.
I'll go first. Just saying that that the library is fully open. We would love to have you come see. If you need a tour or anything like that, be sure and let me, or as a group, if we want a tour, I would love to help you. There are new rules for reserving the conference room and study rooms and the community rooms. Our community rooms we have 3 of them, and they hold 100 each. And so they can be combined to make a larger event. That everything is free for nonprofits, as long as you're not trying to make money or charging to get in. And we're in the middle of summer reading. It's always a good sober social event. So come on by. I'd love to see everybody there.
Thanks, Michelle. I love summer reading. I missed that as a kid, right? I remember getting like the little Pizza Hut coupons when you would read so many books, right?
Yes, yes. And we're actually giving everybody who reads gets a chance to go to the new O'Neill Park. There's
Wonderful.
swimming pools that we just opened this year. So a lot of things that I think benefit everyone.
Fabulous.
It's a healthier incentive than food. Not that I didn't love the pizza.
Absolutely. The more we know, we can make better choices.
Yeah, everybody actually gets a little bit of everything. So yeah.
Absolutely. Well, thanks, Michelle. We're looking forward to utilizing the new community room for our July McLean Ross meeting on July 16th at 3:30. So hope to see many of you there. Tim, I see that you unmuted. Do you have an update to share with us today?
Yes, we have an event coming on Friday. It's a free event. We call it our Summer Fun Day, and it's at Withers Park, 204 East Washington Street from 1 to 3. We're just going to have someone. We've had some donations of food, hot dogs and such, and we're going to cook on the grill. We're going to have some games to play, and just a summer fun day of getting to know other people in the recovery community. So you're all invited, and let anyone know who would be interested. So
Thanks, Tim.
Sounds like a good time.
Wonderful. And I believe that was also sent out via email this morning through the McLean County Ross distribution list. So we'll continue to promote it on our behalf too.
Yes, real quick, flyers are on that most recent email I sent earlier today, and we sent earlier today, so it's all on there. And Tim, did you mention there's one on the is that Fun Day on the 21st? Is that what you're talking about?
Yes, Friday
Okay.
the 21st. Yep.
1 to 3. Yep.
Yeah, and we've got
Where is that
door
park
prizes that were a lot of them generously donated by the Rusk, and we have games and all kinds of things. We're going to do Yardsy, like Yahtzee, but with large dice in the yard, and all kinds of fun things. So come on out and have a good time.
Awesome. Thanks, Tim.
I dropped a flyer in the chat box for everyone to see as well.
Thanks, Sonia. Zach, were you wondering where the park was located?
That's the little one. It's like the grass outside of the PNC Bank downtown. Is that what that is?
Yes, that's correct.
Okay.
Wonderful.
I was just curious. Thank you.
Sounds like it'll be a fun event. Hopefully maybe have some sunscreen and maybe a little bit of shade nearby if possible. Awesome. Any other
Yes, we
updates?
will definitely have a tent up as well, Carrie, for people who need to be out of the sun.
Wonderful. Sounds like a great time.
Hi, I also have an update. If you would like to keep the fun going on Saturday, our McLean County Fatherhood Coalition is doing our second annual father and child fishing event at Miller Park from 9 to noon, and that's this Saturday. We will reimburse you for the $5 fishing license, and there is going to be like fishing poles and bait and that sort of thing available.
Wonderful. Now, if folks, Emily, do not have a fishing license, can they get that on Saturday?
I believe so. I do know that we're accepting walk-ups. I'm not sure what the ins and outs of obtaining a fishing license are. Michelle, do you know more about that?
Yes, there's there on the flyer, there's a QR code that you can go, but it's it's just getting a license through the NDR, the Natural Resources. So their website you can get a 1-day license. You can get more than that, but we'll reimburse you the $5 for that. Nobody is checking your licenses, and then nobody under 16, so 7 to 16, they do not have to have a license anyway. But we'll help you get all that. We'll have access to all of that when you come.
Awesome. Thanks, Emily, and thanks, Michelle, for filling in that information too. And yes, Emily, if you have a specific flyer for us to share on your behalf, feel free to send it and we'll promote it for you.
Great, thanks.
Absolutely.
Also, Emily, did you say that was on the Saturday, the 22nd, or Friday, the 21st?
That would be Saturday morning, so 9 to noon on the 22nd.
Okay, awesome. Thanks.
And if you're going to Juneteenth, why not come a little early and do some fishing with your kids?
We will also be doing Pride in the Park at the same time, so you might as well
Yes.
stop and hit all three.
It is a
Yeah.
big place.
Love it. It's cool to see so many great community events happening this week. All right. Anything else that folks want to share?
Tomorrow is the McLean County Reentry Council meeting at 1 o'clock. It's via Zoom. So I can put that in the chat if we still have time. Otherwise, I'll send it to Kat and you guys can send it out.
Awesome. Thank you so much, Michelle. One other quick update that I do want to provide, and more information will be sent out, but we are partnering with the Yoga Lab in Bloomington Normal to offer some free yoga for recovery classes at Chestnuts Family Health Center. So I went ahead and put the save the date for those classes. We have 2 more upcoming. The next one is Monday, June 24th at 6:30 p.m. And then the 4th one will be Friday, June 28th at 9 a.m. Registration is required, but they are free and open to the public and open to all levels of yoga. So feel free to share those. We'd love to have some great turnout. Our last 2 have been successful. It's been exciting to see the community come together and see the impact that yoga has had for some different residents and folks over at the Chestnut treatment side of things too. So it's been really awesome to see all of that come full circle. The other update I will quickly provide is that we are doing our annual Grady's Night this Friday. We have been sold out since we started promoting the event pretty much. It was pretty great to see within 48 hours, all 40 slots were completely filled. I will say though, we are on a wait list. So if any folks need to make changes to their registration, to email our team or call me directly. All of that information is on the flyer, but also on the poll that they initially filled out for their registration information. So we're excited to offer, again, an opportunity for families and their little ones to come out and have a fun night at Grady's on Friday. So we'll be sending out some more information via email. And again, our next McLean County ROS meeting will be Tuesday, July 16th, hybrid, and we hope to see many of you in person. We'll be sending out the meeting minutes for today, but also be thinking through, again, some of those strategies that we talked about as we continue this conversation next month. So thank you, Michelle, for that Reentry Council invite as well. For the time being, thank you all for being here today. It was lovely to see so many faces on this call, and thank you again for your support and collaboration for our ROS Council. Enjoy the rest of your Tuesday, and hopefully you stay cool.
Thanks, everyone.
Thank you.
Hope to see you in person next one.
Thanks, guys. Have a good one.
Thanks,
Thank
you too.
you.